Hey folks, Dr. Shawn Baker here again. Let's talk today about plant antioxidants. And so we hear a lot about how important it is to consume these antioxidants. We get all these information about their inflammation fighting powers. But what are plant antioxidants? Are they really as good for us as people claim? So let's look into that in today's video. Be sure to stick around to the end while I'll give you a little bit more information about what I think this means. So let's first define what are antioxidants. So an antioxidant is any substance that inhibits oxidation. Pretty straightforward, right? They can be either consumed exogenally or produced endogenously. That means we make our own, and we make quite a bit of our own antioxidants, to be honest. They can help stop damage caused by reactive oxygen species. As a result, they can reduce inflammation. Now, common plant antioxidants include things like polyols, phenols, and flavonoids. Some of the most commonly talked about plant antioxidants are tannins found in tea and berries, beta-carotene in carrots, vitamin C in oranges, red peppers, vitamin E found in things like almonds. All of these have been highlighted of having various benefits to specific parts of the body. Beta-carotene, supposed to be good for the eyes. Vitamin C prevents colds. Unfortunately, research that has emerging shows that these statements don't really hold up well in reality. So let's look at a few of the common myths around plant antioxidants to set the record straight. So number one, humans should eat lots and lots of plant antioxidants to prevent disease. Now again, this is largely, not really true. It's not really grounded in really strong science. Firstly, plant antioxidants are meant for plants, not animals. Okay, it just kind of makes sense there. As a result, the human gut is not really designed to process them well, and we can't use many of them. This is in part because the molecules of antioxidants are polar to the fat-loving membranes of the human cells. What's more, antioxidants are processed in the liver, and because they are difficult to use, many of them are quickly excreted out and wasted out in our urine. And while some health leaders out there claim that these polyphenols are protective for cardiovascular disease, research illustrates that there is no clear evidence connecting the consumption of these antioxidants with reduction in heart disease. And further research shows that plant antioxidants can actually increase, not decrease, but increase your susceptibility to diseases such as things like cancer. Now, claim number two, consuming antioxidants in fruit increases the body's overall antioxidants quantity. And again, this is also not true. While consuming fruit is shown to have an effect on plasma antioxidant quantity, this is due to the metabolic effects of fructose on uric acid levels and not so much the antioxidants themselves. Research shows that these flavonoids, which are often one of the ones that are talked about, are barely absorbed in the body. They tend to increase blood uric acid level due to, again, the fructose level, and they're quickly excreted from the body. So as a result, the body mounts a response to endogenously produce its own antioxidants to counter the effect of the potentially problematic compounds produced by these antioxidants in the fruit. So what's happening is, it's harming the body in a way that we produce our own antioxidants. It's not that those antioxidants are getting in the body and becoming protective to us. So it's almost kind of like a hormetic effect. So again, over time, if we eat a lot of these fruits, and particularly the fructose in that, we end up having difficulties producing our own antioxidants to keep up with the amount of deleterious compounds that are elicited. And so we often end up with high levels of uric acid, which can lead to things like gout. Claim number three is plant antioxidants have been shown to been helpful for autoimmune patients. This again is not really grounded in much science. A recent study shown on rheumatoid arthritis patients showed they found no correlation between increased antioxidant intakes and lowered pain levels. Despite eating a Mediterranean diet high in antioxidants, rich in fruits and vegetables, the participants in this study saw no changes in their markers of oxidative stress or total plasma antioxidant levels. This signals that the antioxidants are at best neutral for autoimmune patients. But is there something that you can eat to help with autoimmune disorders and chronic disease? Yes, there are. And so we have seen significantly time and time again that when people, first of all, remove all the processed food from the diet, when they consume high quality, highly bioavailable animal products, that often their autoimmune symptoms go down, and there are studies coming in the near future to support that. So again, I think what we should take away here is that most of the antioxidants you consume, particularly when they come from plants, again, they're not designed for mammalian tissues or even animal species tissues. They're designed to work within plants. They are mostly broken down very rapidly. the effect that we have, the quote-unquote beneficial effects, are often hormetic. That is, it causes a stress on the body, and our body fights back by producing our own antioxidants. And so those are the perceived benefits. Now, again, is that the best way to do that? That's debatable. I would say perhaps not. Anyway, you guys take care. We'll see you on the next video. Don't forget to like, subscribe, hit the notification bell. Take care.